Welcome to Conversations with Shlomi. Hi, I'm Shlomi, your host. I've discovered that vulnerable conversations lead to some of my richest insights and personal growth experiences. So join me as I sit down with guests who inspire me, and let's explore our ups, downs, and everything in between.
Enjoy listening.
Today, I get to sit down with Dr. Elka Jacobs-Pinson, a seasoned psychotherapist, I think with over 35 years of experience. Started in art therapy, trained in EMDR, IFS, and trauma, very trauma informed, and a storied history of both working in inpatient and outpatient clinics, and currently running Crown Counseling in Crown Heights with around 30 therapists. And it's my real pleasure to sit down and pick your brain today about therapy.
Pleasure
Welcome.
to be here. Pleasure to be here. Thanks for having me here.
What should be added?
Well, those are always a good question. What's necessary and what's to be added? A person, not just myself, of course, is a sum of so many things that you can't say any part wasn't necessary, because where I am today is always a sum or summary of many, many, many different experiences and life experiences. So I guess they're all necessary. What's important, that's also a judgment call. But just to give a sort of the most basics for what it's worth, I was born and raised in Brooklyn, lived on Long Island, conservative movement, traditional family. As a teenager, moved to Vermont, which was a very important life experience. Lived there for a couple of years, went away to art school, did art school, graduated with a degree in fine arts, worked in that area, and then became an art therapist. So the background in art predated the background in mental health. I think that's kind of important because, we like to think that people can grow and shift and change careers, change direction. And I'm proof positive of that. And so I think those are pretty important. And then the trajectory since then is also important, which is the career since around 1980, when I entered graduate school in psychology and got first license in 86. So all those years, I've been a practicing psychologist in many formats, many settings and so forth, mostly here in Crown Heights.
I wonder if this is really the work of therapy, is to take all of our disparate backgrounds, some of them even that were difficult, and some of them that we've really suffered, and we've wronged, and we haven't done 100% the right thing, and to be able to create a wholesome picture out of it, that for the person to understand that they are a sum of all their parts. And precisely because they've had all those experiences that have sometimes felt hard, wrong, and wasted, and somehow bring it all back together and say, you are here today as this beautiful person that you are, precisely because of all those things that have happened to you in your past. And if I wonder if, like, in some ways, isn't that really the work that we do in therapy, to reunite all those disparate parts and bring them into oneself?
Right. Well, some of it is parts, some of it is experiences, which may or may not reflect or conform to those parts. But the thing that I most believe is that nothing is wasted. Nothing is wasted if you find use for it. Now, you could say I wasted time doing this or that, but realistically, if you look back, there probably were lessons learned, or we hope there were lessons learned. I tell people who are dating, even if it's not the one for you, what did you learn, right? Every experience has some learning component. So if you go backwards enough into your life, you will see whatever messages or whatever you did with it. And people who want to make changes, I see this all the time, and I have these sort of like little struggles with them. People say, well, if I'm going to go to school for this or that, and even if I'm not totally sure, and I say, well, you could always change in 2 years, 3 years. They say, well, no, I can't because it will have been wasted. And that idea of wasted is a very, uh, it's not true from my perspective. I know what people mean, right? We don't want people to waste time, but intentionally, but the idea of integrating that and using that towards the next step, your next project, your next career, your next life choice is always there. Not to think of any as wasted.
I actually feel like you can't waste your time even if you wanted to, because even if you
Well,
if you feel like you wasted, that itself is a learning and a teacher.
yeah, yeah,
Like, this doesn't feel right to my mission, and I want to, and it informs my drive today to make the
exactly,
change.
exactly.
Right.
Yeah, yeah, yeah.
So you started out as an art therapist, or as an artist for that
As an
matter,
artist, but I knew pretty
right?
soon after college. I graduated from Pratt. I knew pretty soon I wasn't going to be a studio artist. It was too isolating. It was too, I really had no vision of earning a living doing that, even though I think I was moderately talented, but I just didn't go for that. And one of my art teachers, a painter, said, oh, I used to work teaching older people, senior citizens, arts and crafts. It's a very humane thing to do. It's pleasant. The pay was good. And I got a job working with senior citizens all over New York City in senior centers. Did that for a while. And
So what
yeah,
made you shift into the therapy part of art?
right. So I was in therapy of my own at the time. And I guess I was doing recreational arts and crafts, which was nice, but it wasn't, it didn't sort of point to a future. I actually had a little bit of a future because I worked at a nursing home for a while, and there was a little bit more, but it wasn't satisfying. And my own therapist said, oh, have you ever heard of art therapy? And I truly had not heard of it. Looked into it and quickly just enrolled in a program at NYU in art therapy. And I loved that, really, really loved that. Had a lot of wonderful internships with all sorts of populations, inpatient schools, drug addiction. Those were my first real clinical experiences. And then worked in that field for a few years, mostly in inpatient psychiatry here down the road at Kingsborough Psychiatric Center, which
Mm.
everybody remembers. Local people might remember the big tower, which was Building 10. There was this big ominous tower, the real symbol of locking people up, and they tore that down a few years ago. But I worked in Building 10 with chronic schizophrenics.
You've witnessed the evolution, I guess, in some form of psychotherapy. I think when you probably first entered, it was very evidence in CBT.
New York, at least at that time, was very analytically oriented, just the whole of New York City. Everybody was in analysis or, either a supervisor or a therapist or a patient. I mean, that was the world. NYU itself was also very well known for analytic. It has an institute and, so we were sort of protected from the evidence-based things. We never thought it wasn't evidence-based. We just thought it was the right way.
So what propelled you, so you were trained in IFS, which is Dick
Much more
Schwartz's internal
recently,
family system.
much
What
more.
what made you say, hey, analysis is not enough, if you will, or it's not the only way? What propelled you to do IFS and EMDR
Well, this is
as
many,
those things
many years
came
later,
online?
remember, so I got out of that program in 1986, okay?
Hmm.
And I set up a practice, and I had an office in Manhattan, I had an office in New Jersey. I mean, to make a long story, I mean, I did a lot of other kinds of work before EMDR and IFS and all that stuff. So,
Hmm.
you know, so I was in that world, uh, school interventions, working with therapists in schools, things like that. But at some point, it's funny because over the years, I would look at some of the publications like Psychology Today or whatever, like Family Therapy Networker, right? And
Hmm.
there would be ads for EMDR or IFS, and I had no idea what it was. I had really, it was like, it sounded to somebody from the background that I had been from, very hokey, very techniquey, like packagey, commercial. So I sort of avoided those sorts of things for the longest time. And then eventually, I'm not even sure exactly why or how, but 20 something years ago, which actually was, that stuff came in, let's say EMDR, maybe the 90s. It was sort of uh, revealed, in the 80s, I think Francine found.
Hmm.
So in the
Right.
90s, and then I sort of ignored it for a long time until around 2002 and started investing myself in it a little bit. And I didn't quite get it. Like I took part one of a 2-part training and I said, well, this is interesting. There's something to it, but I couldn't absorb it. And I find, at least for myself, many, many, many things. I can hear it, read it, learn. I don't get it. But if I go back to it a while later, I'll say, oh, okay, now I can. That's like with math or something, like I could go do high school math now, but at the time I had no idea what it was. It was like, leave me alone. So I did some EMDR, and then I kind of sat back and avoided it for a few years, and then said, wait a minute, let me go back into this. And I did, successfully do another training and several trainings just to get some facility with it, and got some supervision and got certified. And I think it's really an amazing, modality.
So I just want to take a quick moment, and for those who might not be that familiar with what EMDR is, EMDR is Francine Shapiro um, didn't invent it, but she definitely brought it in some form to the world. The idea that when you process certain trauma through tapping and eye movements, rapid eye movements, and tapping the left and the right side of the brain, not even sure as to exactly why it is so, but just that it is so, that there is a ability to take memories that seem to be floating and not stored away correctly because they're not processed correctly, and to be able to use that process to allow those memories to properly conclude and be put in the right part of the brain and become part of the past. And please correct me if I described it wrongly, but
It's
that's the idea.
bilateral stimulation. It's simple as
Hmm.
that. Bilateral stimulation of various sorts. I'm sure the most effective, and the way I was trained particularly, but eye movements is sine qua non of this bilateral stimulation. And what what ironically, is called eye movement desensitization reprocessing, and it's like really a mouthful, and it only suggests eye movements. But of course, Francine, I think later had said, I read what she had said, the 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 actual functional, what do you call it, uh, uh, mechanism is adaptive information processing, AIP. And she should have called it AIP, because what you're doing is reprocessing or newly processing information to a positive adaptation, right? So whatever happened then was not fully integrated, was not fully processed. I like to use the analogy of, it wasn't digested properly. And we need to digest it. We need to put it in its proper, pull the nutrients out, put it in its proper place, get use out of it. That sort of actually reminds me of what we were saying before about making use of the past, and making use of all experiences, right? Ex- Extricating or extrapolating from all experience to get some benefit. What did you learn? Right. And that's using. Yeah.
So maybe if this question can follow this is like going into the field from art and then analysis, um, realizing in the early 2000s that wait, there's a whole other way to help people through a process that is adaptive integration. Um, what was one of the beliefs that you've held and it kind of felt very strongly like early on that shifted over the long career that you've had, and a belief or an idea about what therapy is that I might think about it a little differently today.
Mhm. Well, now I truly believe, perhaps I was not as aware of it then. It wasn't part of my language then. The idea of information was not part of the culture. It wasn't about information, it was all about feelings, right? It was all about feelings, and it was all about the unconscious. Unconscious is a powerful thing, but feelings and roots of things. And I've become much more, interested in looking at what information, because I think that cognitions and feelings and all that are based on a certain information that somebody extracted from a situation. So if you were in a situation, you extracted this information, let's see how can we shift it, right? So even if you're talking about uh, now information, and what is clear in EMDR and other approaches is that information comes from many sources. It's not just something. It's sensory information. It's somatic information. It's um, you know uh, verbal or nonverbal cognitions. It's all kinds of sources of information. That's what you use in therapy. All kinds of sources of information that happen primarily at the time of trauma, if we're talking about trauma, but even in the present. What's the information that you're working with? What do you know? What do you know? And sometimes people have broad knowledge, and some people have very narrow knowledge. Like, one of the first things that many therapists do with many clients is when they come in the door and you find out what's the problem, you hope you can normalize it and say, well, gee, a lot of people worry about that. A lot of people have that. And somebody will say, really? Yeah, well, 3/4 of the people who come in here have that same concern. So I guess you're not alone. And once people know certain things, that other piece of information, if they can hear it, they can start saying, wait a minute, okay, it disempowers it, or it kind of puts it in its right perspective for working on it. Now you have what you're working on. Okay, a lot of people have this. Now, what flavor is yours? Yeah, a lot of people have it. What flavor is your take on it, your particular take on it? So that we're still dealing with information, but we're narrowing the path, you know.
Let me reflect this back, and I'm wondering if I understood this correctly. Like, initially, my training and my understanding was that it all depends really very much about the experience, the feeling of what happened or is happening for me with what happened in the past. And today, I am more aware, you are more aware that no, there's also the m- information, and information is somatic, like the body giving us information, um, what the actual circumstances a little bit and how I think about those are equally as important. It's not all about the subconscious, how did that make me feel, but also what actually did happen, what information do I have available, and how do I process that too.
Objectively, the objective facts of the situation, and then the interpretations and the reactions. And, there's a lot involved there. And, um, sort of winnowing down what somebody extracted from that and seeing if that's, healthy or not good coping and so forth. Two people, as we all know, two people could be in the same exact circumstance and have completely different views of it and completely different experiences and extract completely different messages or lessons. So why is that? Right? I
Does
is
everybody need therapy?
No,
Should
no.
everybody go to therapy or no?
That well, if you depending on how broad the umbrella is for therapy. A lot of people, I think one of the things that's happened in the last few years, and there's a lot written about it, is that children and teenagers and adults often don't need therapy, but they do need to talk. They do need validation. They do need support. They do need resources. They do need psychoeducation. They they do need support of all sorts. Whether or not they need a therapist, I guess the parents have decided they do. Parents are frightened that their kid is not going to succeed or do some, or will do some awful things. And unfortunately, we do learn through hardship. Now, I'm not wishing anybody go through hardship. However, you can't not encounter hardship. Hardship does help sometimes if, titrated, right? A certain amount of challenge, right? And we have a lot of people coming in and, a lot of, I think the most popular diagnosis, at least that I've seen in the practice in the last couple of years, is generalized anxiety disorder, right? Now, a certain proportion of them may have some other diagnosis lurking under the surface, or maybe it's but it's just a general anxiety, worrisomeness that bad stuff is happening or will happen, or they can't handle things. And the things that they can't handle to some degree are often just normal life things that people will be given. Now, far be it for me to turn away business, but a lot of times they are things that in past generations people would say, okay, listen, you'll get another job, or you'll figure it out, or you can handle your kid, or don't give in, or all the kind of things. And to make that discrimination about what needs to be treated professionally and what needs to be not dismissed, but minimized and embraced, or dealt with in another way, right? And so there's, you know, um, in the past, people might go to an elder, might go to a bubby, they might go to a rabbi for advice or guidance, and that would be it. And now there's a lot of parental anxiety, particularly about like their child, how is their child going to do, right? And um, again, I don't, I can't disabuse a parent of being concerned about their child. Obviously, they're concerned about their child, but they're also saying that they don't feel confident enough in themselves to handle it, and that they are, as parents,
Mm,
are okay, and they can handle it properly. Maybe they need some guidance, or some support themselves, but the kid's going to be okay. You know,
mm.
um, you know.
Let me reflect this back in a little bit my own words, and I think I have a question about it. Um, we need everyone in order to become more resilient, be able to handle adverse moments in life. We need to have a manageable amount of adversity as we grow up in order to be able to learn how to handle adversity and not to fall apart in adversity. And the question basically is, as parents, how much of that adversity do we allow and leave and, so to say, not treat?
Mhm.
And how much is too much and that will derail a child or even an adult and not allow them to grow through that adversity, but the adversity will take them off course. Um, I think the famous idea of being a snowplow parent, basically where you take away every single possible moment of difficulty for our child, it feels really good for us as parents, but we leave our child almost defenseless. That when there is in real life afterwards moments of, someone says no to you when you're dating, or even more difficult moments, and I don't know how to handle myself and what to do with that. And I think something very interesting that you said is sometimes the anxiety is the parent's anxiety more than the child's. Like the parents don't seem to be able to handle themselves kind of with the feeling, I'm okay, I can handle my child's hard moment. Yes, they came home from school talking about how they don't have any friends or not enough friends, or the friend this and this friend did. And I have the ability to hold them through this space and and make them stronger from this experience without making the situation, without calling the teacher right away and saying, well, can you change my class, or can you make sure that this friend says hello to this child, etc. which I guess makes me wonder, is there is there such a thing as too much therapy, over therapized people? That means, when it comes to, let's say, a young man or a young woman who's about to get married, but they cannot take that leap of faith, which requires, it's a bit of a leap of faith, to attach yourself to another person. But I am so overcome with all the possibilities and all the feelings and all the anxieties that can come with it, because I'm so aware, I'm hyper aware of everything that can be, that I have almost too much therapy, like that stops me from just showing up as a man in my masculine, as a woman in my feminine role.
There are times, that it's kind of interesting with change. The children, the rule of thumb with children is the least therapy, the better. In other words, if they need help, which is a question itself, but if they need help, it should be short and sweet and given back to the parents, right? That's the general rule. Once a child starts going to a therapist for a long time, of course it could be a positive experience. Of course it could be a positive attachment, but you don't want the child to start seeing themselves as defective or needing to talk to another person, a therapist, rather than, because the goal clearly is to have the child function well in the world. And also, very important, you want the child to be able to function by talking to his parents. The parents should be the go-tos until, until and including when there's friends and other people. But the point is, it shouldn't be a therapist, because the definition of a therapist, but by definition, is that it's going to fix something, right? It's going to treat, cure, fix something. Therefore, that means something's broken, right?
Mm.
Something's wrong, something's off. Now, an adult can handle that, that a little bit better. But for a child, you don't want them to start seeing themselves as damaged, you know. Um, I have more to say about that, but just putting that aside for the moment, the for an adult, of course, it's different. It depends on the age of the adult. It depends on the stage. Classically, I mean, I don't know statistics, but it's very clear that most therapy clients are in their early to mid 20s. The vast majority of people who go into therapy are young adults, you know, um, which is neither good nor bad. It just is, which is, uh, that's a time of a tremendous amount of upheaval and change, as, as it should be in a certain way, changing your path and your roles and all of that in life. So you gave an example of people using it as a resistance to growing up, or a resistance to moving forward, which I suppose it can be. It could also be a great tool in moving forward, depending on the individual. So you're sort of thinking about maybe even the worried well who lean on a therapist before they can make any decision, right? They're just dependent personalities, perhaps. Um,
Becoming more dependent because
or
of it.
becoming dependent. Well, I think a therapist's responsibility ought to be, in most cases, obviously there's exceptions, but in most cases, to be unnecessary, to become an unnecessary person in that person's life, to let go, to push them out of the nest, right? Um, when people come in, they often say, "Well, how long is it going to take?" And there's certainly no clear answer how long it's going to take, but it should be the most effective in the least amount of time, and then goodbye. Right now, of course, it may take longer than at least amount of time. It could take a couple of years. Who knows? Depends on the individual. But the idea that somebody is using therapy as a defense, essentially, or resistance against growing up, moving on, making decisions is again, there's personalities who are like that, but that's the core challenge, or the core topic of discussion in the therapy. What keeps you from moving forward, right? Making decisions, spreading your wings, however you want to put it. Yeah.
Which a lot of people come to therapy saying, I feel stuck. What does it mean? as a therapist, how would you define being stuck?
I'm stuck could mean I'm stuck in a dead end job. It could be I'm stuck in a loveless marriage. It could be I'm stuck repeating some behavior in my own, or stuck on a thought. I don't know what stuck means. Each individual, we all have been stuck with something at some time, indecisiveness or, a bad habit, So it really depends on what they're stuck with. Right.
But what's not stuck? I think that's maybe a little easier to
Okay.
define. Like,
That's a good one. What's stuck? Non-stuck is meaning spontaneous, uh, being in the flow, um, open, not unnecessarily guarded or tense, um, uh, adaptive coping, making decisions, moving along, um, not repeating either behaviors or cycles of behavior or relationships that are, negative. So there's a certain part of getting, you know, in IFS, there's, the core belief, I suppose, is self-energy, that we all have self-energy and it has to be accessed. Okay. Either we have access or we need to have more access. And as we get better, we have more access. We become more our healthiest self. And that's the goal, I think, in any therapy, right? Our healthiest self, our best, the best of our best, Those things are lifelong projects. And even with IFS, I suspect it's a long-term project. Nobody's going to get, you know, you try to take the layers off. You try to kind of work on the most maladaptive parts, but you're never going to get, pardon me, but everything, right? People always have something. But as you get older, of course, and hopefully through life and experience, you're going to, like get more relaxed. You're going to get more accepting of yourself. That's a part of, I think, aging is just more self-acceptance, more maturity, more distance, more whatever you want to call it, but sort of letting go of a lot of things, good or bad, like for, is it good that you let go or is it bad that you let go? I don't know. But the point is that you've, un, uh, uh, there's a word, things are not so mystifying anymore. They're no longer shrouded. They're sort of like, oh, whatever, Some of my illusions, certainly myself and other people, the illusions are sort of taken off. You get rid of them. And that's closer to self. You're getting closer to self, your illusions, your maladaptations, your defenses, resistances, things like that. Uh, uh, reveal the core, right? Make people relax in a certain way, like be comfortable with yourself, you know, polish the edges, yes. Work on things you have goals, yes. But to self-acceptance, I suspect, and self-appreciation,
so I
flow.
wrote down the word self-acceptance, and I'm curious, like, does this mean to say that so much of the work really is that not obviously we change with things that are really dystonic, things that really don't fit right for us. But on some level, it's really the work of you're okay as you are. There's not so much maybe I'm okay with certain things that I do, and I wish maybe in some form I would have done them a little differently, but I'm okay. I'm a good person with this behavior. So there's a lot of the work in some ways is to say exactly as I show up today and how I am, I'm okay. I'm good.
Well, it's self-esteem to some degree. People have, for whatever reason, I think self-esteem issues have always been, I suppose, always will be at the core of pain. Am I worth it? Am I capable? Am I valued? Am I acceptable? do I have enough, power, strength, whatever, am I acceptable? Am I okay? Am I rejectable?
Right.
Like as the opposite, and just coming to terms with those issues. I mean, that's what people basically come in with. Am I going to be okay? Am I okay? Am I going to be okay with what I've got? Yeah.
And I think that there's two different states in that. There is like the core state that I am okay just because I am, not because I did accomplish or not accomplish. Or if I wake up in the morning, and maybe to add a little bit of a spiritual idea to it, that if I wake up in the morning, I am worthwhile, I am lovable, I am have a purpose, because otherwise I probably wouldn't wake up in the morning. And then there is a piece also, am I can I esteem myself? And that is a bit more dependent and changeable or malleable by to the experience of myself with others. Do they see my value? Do they see my capabilities? Do they see simple, like, am I a good therapist? I might tell myself I'm an excellent therapist, but if my clients don't get an experience, or my colleagues don't get me to allow me to understand that I do good work, that is another way of building maybe the esteem part. So there's kind of like two separate parts. One, I am valuable, deserve to take up space, and there's nothing that can shake that. And then there's also the part of, how do I bring value? Can I see value in myself?
Right. Well, you're talking about whether I have skill or talent or ability or capability, to do or to provide, like perform something to do with performance or actualization in the world. I'm valuable, but
How do I show
what
it?
am I gonna do with
How
it?
does it express?
Yeah. How does it express itself? Yeah. Yeah.
What would you say to someone who comes to you or to your group and says, listen, I've been in therapy for 20 years. I've tried everything, and really I feel like nothing is changing. What are they missing? What's the kind of work that you want to do with them? What's the message that you would have for them?
I would first want to know the details of that. What do you mean? What hasn't changed? What do you mean by not changing? No,
Mhm.
if you're a full grown adult and you're a certain height and whatever, you're not going to change that, right? There's certain things. There was a book written by Seligman years ago, um, Martin Seligman, about what you can change and what you can't. Okay, there are some things you can change and some things you just can't change. Your temperament, you can work on it.
Mhm.
Hard wiring is a certain way, right? I'm sure people are going to jump and say, yes, you can change your temperament, but you're working with a given. You're not changing the given. You're working with the given towards improving it, using it properly. Okay. So some things you won't change. Um, you won't change another person. Except maybe a child, I suppose you can work on that a little bit, but you're not going to change other people. You can change how you react. You can change how you understand things. You can change what you do with that information, of course. But you're not going to, what do you want to change? So the first question would be like, what did you think would change? Or what has been the biggest frustration with, when you say lack of progress, what do you think it is? You put 20 years into lack of progress? Is that really, really, really true? Do you know what I mean? I would have a lot of skepticism about such a person unless they are somebody who has some really intrinsic, some people who have real, let's say, neurological or neurobiological kinds of limitations.
I'm thinking again about the beginning of our conversation, where probably for that person, they've not been able to take all their pieces and make sense of it as a whole. They haven't been able to take their story, and all the details, and somehow brought it together and say, oh, that's what makes me me today, and I accept the me of today. And that would feel like a lack of progress. Like, I've gone through many things, I've maybe even traversed many life events, but I still feel not accomplished. I feel like I'm not sure what my purpose
So,
is, and
right.
I
So,
have a lot of regret and
right. So you
things like
have to
that.
think through that and say, well, wait a minute. Okay. So you did A, B, and C, right? And
Mhm.
despite all of that, despite those achievements, despite those accomplishments, whatever, and you're still feeling frustrated. What is it? And get to the roots of that. Where's that frustration coming from? What role models did they have? What expectations could be really way off about what they expect life to be. Where they get these ideas about life, right? Um, healthy people have reasonable expectations, right? Um, and at reasonable or validatable junctures, right? By the time I'm 30, this is likely to happen. By the time I'm 40, this is possibly, certain kind of time goals. But you really have to go deeper. And you mean you stayed with the therapist for 10 years and you didn't progress? Is that what you're telling me? So wait a minute. Why'd you stay with him if you feel like there was no benefit? Well. And then you find out this is a dependent person, perhaps, who really the dependency was not, he didn't work through his dependency. Let's put it that way. The therapist did not help him work through that dependency or
Mhm.
so forth. So on. I mean, it's, hard to talk about the hypotheticals, but there's always something beneath and beyond these fetches, right?
Right.
Yeah.
Do you have a moment in your career that, or maybe a client that you watched a little bit their transformation
Hmm.
that brings you a lot of joy, that surprised you, um, that obviously not without sharing too many details, but like something like that really moved you?
I'll tell you a very short one because it really moved me and it was um, so important. A number of years ago, I saw a teenage girl. She was actually not even here. She was from Borough Park or something. The parent brought her to me for several months. I don't recall the very, to say quiet was an understatement. I mean, she was almost silent in sessions, very guarded, very inhibited. I don't even recall exactly why she came to me, but it was nothing extreme. It was nothing extreme. But I could not open her up in any way, shape, or form. She was just unable to spontaneously, yeah, a few words here and there. So I said, I have to do something. I can't discharge her with no, no more efforts. And so I tried in my way to just schmooze, right? I would tell her stories about myself at that age. I would make up things. I would try to engage her in any kind of positive, entertaining way. And I felt like I would say failed because I knew it was not me. It was something going on that she could not absorb the nutrients, right? And maybe we could even put a bookmark on that topic right now. But she so she left treatment after a few months. It was on good terms. It just didn't seem to be clicking. And about maybe it was 6 months or a year later, I got out of nowhere a greeting card from her, and it was written, "Thank you for all your help. You have, thank you something. I just want you to know how uh, how much you helped me." Unsolicited. Something happened that it was in here. It made an impact. You don't know. You try your best. I've had many clients, and because I'm here so long, I have the benefit of people now and then coming up to me or calling me and saying, "By the way, what you told me back then, I think about that now." And I think, what did I tell you? Because I don't necessarily remember. And in fact, what I told them, what they remember, is not something I would even think would connect, right? I might have said something unintentionally or by the way, and somehow it hit something that, right, and took root, right? And it's fascinating because it's not, the thing you think you're telling them is not necessarily what they're hearing, right? Always have to check that out. What are they hearing?
Right.
you know?
So maybe going back, and I think it connects
Yes.
very much, this pin that you just put into like absorbing the nutrients.
Right. Right.
So
Right.
you felt like it didn't absorb, like no, like your treatment slash your psychoeducation, your relational part just didn't hit home, or it didn't um, affect this young lady, and yet somehow for
It
her
did.
it was all the change she needed. What
Sometimes
is that?
out there, right, the change doesn't necessarily show in the session. I mean, it didn't show in the session. It may have showed out there, right? Somebody may be trying something differently or hearing my voice in their head out there and saying, you know, Elka said, or whatever. I know that's happened many times.
Mm,
Elka said. It's hard because you want, we're normal. Yeah, we want to see progress. We want to hear about it, but we may not have that luxury.
mm.
We may not have the luxury.
I love that that's the example that you picked, because it's not a self-aggrandizing moment at all. It's a moment that you felt like, hey, I failed. Like I did whatever I can, but I wasn't able to maybe get through. And yet somehow beyond yourself, the role that you played that seems beyond of what I feel like I contributed, seems to have created the change. And I love that you picked that as a moment. That's actually
I think
telling.
yeah. I mean, it was a very special moment for me. Let me put it that way. It was totally unexpected and so sweet, and I knew it was genuine. It
Right.
wasn't just, oh, thank you. It was real.
How has being a therapist shaped you and your journey of self-awareness, your journey of integrating self, of, like as you said maybe before, of like accepting your limitations and being more okay with them? How has it shaped you? Enjoy. Or has it shaped you?
No, no, no. It's changed tremendously, although I can't, you know, point to exactly when and how. It's been a progression. I think when I look back at my first years as a psychologist, as a psychologist, is a little different. When you're doing evaluations, it's very structured. And I felt very competent in that. That wasn't a question. I got I got the information. I wrote up my report. I got the product. I gave a diagnosis. It was useful. There was no, that was a good experience as a professional, right? Without question. But as a young therapist, and certainly many years ago before I had kids, when I was young, truly young, look back and I think, what the heck was I doing? I can't, I can't even imagine. Maybe I was compassionate. Maybe had some insights, but in terms of really, truly getting what the people were there for or what they really needed or how to handle things, I'm somewhat upset over thinking. I get upset when I think about what I was doing. For myself, it was fine. I mean, I didn't have any pain. But did I help anybody? Or how much did I help anybody? Was is a question. I think unfortunately, it's not my fault that I was young, and it's not a young therapist's fault that they're young. But and sometimes they could be extremely talented. Nonetheless, um, perspective is something you can only gain over time, and priority, proportion. Um, these are only things you gain over time. There's no shortcuts. There are some people who are very wise young. There are people who are, they have a knack. But when you're a young therapist, to try to treat people who are significantly older than you is impossible, just impossible. And even people within your same age category is, it's questionable, right? That's why a lot of the, let's say, programmatic treatments, the package treatments are so, I don't want to say useful. They're useful because they have a regimen, they have a protocol. So you can't go wrong. But the fact is, what you as a person are bringing to it is very limited, right? And it's a
So,
shame because when
as
I
a
was, yeah,
yeah, no, I
when
was
I,
just going to reflect on this. That means as a young therapist, having kind of a very structured modality to work with can be helpful
right,
because the relational aspect is not fully there yet.
exactly, exactly. So you have a framework within, with, you have the prism, you have the grid of how to see this person's problem. And the
Hmm.
grid is sort of protective in a way. It gives you a synopsis of what's going on, and you treat it with some kind of protocol, and hopefully you'll be successful. But in terms of other aspects of yourself, whether it be life experience or, uh, uh, pieces of life knowledge, I mean, the I think there's two things I wanted to say about this because it is quite important. One of the benefits that I had is that when I started out, I went into a program that was technically, officially child psychology. It was professional school in child psychology. So most of my work was with kids, and which was great. I liked it. Kids, of course, being teenagers too. But it gave me the opportunity to work with kids. And of course, as a young, not as young adult working with kids, I was a kid. I could relate, right? But what we have now is I, I find it fascinating because almost nobody wants to work with kids. I find we hire therapists. I'm always looking for child therapists. Nobody wants to work with kids, which is a shame because they're young adults. Who are they going to work with? Work with kids, see what it's like. You can relate to it. Kids can relate to you. You can't relate to people who are 20, 30, 40 years older. Well, I mean, sure, you can relate as a fine person, but I'm saying in terms of the uh, uh, life experience and wisdom and relating on certain features of maturity and so on. You just can't. So work with kids, get experience.
I,
I
I,
really
I
encourage
think
people.
what you were saying in pretty straightforward terms is if you're a young therapist, work with kids because you will have a hard time relating to even potentially people your age, but definitely people older than you. And if you want to gain and learn that perspective and the life experience and the ability to relate, work with kids because they're
Work with,
closer to you in
of course,
age
that
and
also means you're going to work
you've
with parents.
experienced that.
And when you work with
Right.
kids, you're going to work with parents. Now you have experience. You were a kid and you had parents, so you have some feeling for this intrinsically. So consider that it's good work, you know, and
Do you think
the
there are too many new therapists coming online?
yeah,
Straight
not
up.
that there's too many in number, too many raw people, too many
Meaning,
people with slapdash, quick training. I mean, I really, I have strong feelings about this. Uh, it has nothing to do with their character or their goals or their desires. I think they just rush through programs with minimal preparation, with minimal of their own therapy. I mean, I unfortunately I've have some therapists who have never seen a patient in person. They've only worked remotely, only remotely. I'm not saying that they choose to work only remotely. They never worked in person. It's these are the programs that people are going to. Okay, I have therapists who have not read a book. I mean, I have therapists. I've interviewed therapists. They have never read a book. They've read a few articles. They've only read self-help books. No,
theory.
theory, very little developmental psychology, which I think is the core of all of it, right? Um, it's not, if I ran the world, I don't run the world. This is what the world has brought us to, but it's very sad. It's sad for them too, because there's this sort of gap, it's become what do you call a cash industry, which I would say
A cash
resent.
industry on behalf of the schools that are minting these
Big
non-ripe
bucks.
therapists.
Big bucks. Yeah. Yeah.
Going a little bit outside of your work, like what currently brings you joy?
When I'm not fighting myself, when I don't procrastinate, when I don't get tied up in my own um, indecision and distraction, I do artwork. I paint, I draw, I do collages. I hope to do more painting, but I've done things that are more manageable. I mean, over the years, I've always done, needlepoint and knitting and all that kind of handiwork. But now I'm talking about fine art, and I hope to develop more of that. I have not a huge, but a substantial quantity of works I've done over the years. And I hope to go through that. And one of the things that's helped me tremendously, which is kind of interesting, because when I started going back into doing, you know, two-dimensional artwork, which was maybe at the most 10 years ago, I started listening to a variety of podcasts, just like You Want to Be an Artist or uh, things like that. And most of them were run by, aside from ones that were just sort of like art history, but I'm talking about like art coaches. And the principles of coaching are pretty much the same in every field. It's just one may be a business coach, and one may be an art coach, one may be a public speaking coach, but coaching is coaching, you know, certain principles. And I've listened to a lot of those. I've selected a few that I really like, and it really has helped me in all areas. Like it's transferable, right? Um, Good work habits, uh, organizational processes, moving forward, not, trying to not procrastinate, trying to not, uh, use excuses, and that's true in all areas. So whatever I've learned in terms of the art coaching has also sort of gone back and helped me in building the practice and helping my supervisees and therapists who work here, right? So it's kind of an interesting, you know uh
Convergence of
yes,
hobbies
exactly.
and practice, but that all seems to again coalesce into this person that you are now and
Yeah, I mean,
unify
whether or
into.
not you're making decisions about, do you know what I mean? I think you do know what I mean. That what it's all the same, right? It's just different uh, uh, formats and places that you're doing it. Yeah, yeah.
In a way, like I actually want to bring this back. Like I think as much as we just spoke a little bit of outside of work, but in some ways, if I would be able to share with my clients, one of the most important things is have something somatic, have something that you have joy in outside of work,
Mhm,
raising kids and
mhm.
being a husband or a wife, that is just yours, that brings you joy. It gets your body, your somatic self involved. How important are those hobbies? And they can be whatever they are.
Old days. In the olden days, you call it hobbies, recreational hobbies. And people had more, I think. There were more literally hands-on things, and it could be anything from making something to making music to collecting stamps. I mean, it doesn't really matter what, but something that is either tangible or concrete or material, that you're engaged with, right? And that's yours, as you said. And I really encourage that tremendously. It's interesting. I was talking with a bunch of young women lately regarding shidduchim. I mean, it wasn't my practice at all, but I was just asked them, okay, so you go to school. What do you do after? What do you do? You have free time. What do you do with your free time? And several of them had no, oh, I listen to music. It was very passive, right? Oh, I hang out with my friends. I mean, they're fine things, but I think there's so much to be said for a hobby or an interest or you know, uh, and it not only tells a lot about the person if they do it, but also it gives to them. I don't know, why people don't have a hobby. It's
Yeah.
fascinating to me. Most people I
I
know,
actually am when you go through the life transition of maybe not being so active in your parenting mode anymore, your kids are growing up, maybe you're becoming an empty nester.
Yeah,
And
but how
if
come
you
the
don't,
young girls or the young men, for that matter, young girls, so they have free time. Okay, we're talking about free
oh,
time, right?
yeah,
It could elementary, junior high, high school. We have a few. It doesn't. We're not talking about like a major. You know, I play an instrument, or I don't know. I read up about something.
I
I
travel.
think
I have interests that I want to study and learn that are mine, not school or not job related, etc. What are you, as a practitioner, with especially with so many years, what are you currently learning or unlearning about yourself as a therapist
learning about myself as a therapist.
or as a person?
What am I learning or unlearning? I think the unlearning is probably more apropos. What we were talking about before about letting go of a lot of things. Illusions, expectations. Um, Now, this could just be me. It may not be it may not represent all of people who are maturing, or, in other words, I don't know if this is a stage of life or just me. It may be both, you know, letting go of things. I think, yeah, letting
Letting
go.
go of things, ideas that I held about myself that I felt were important, and realizing like I can let go of.
Yeah, it's something like that, y- what I thought was really important, what people would think or say, that kind of thing. Oh, if I do this or say that or wear this or whatever, those kinds of things, which really ultimately they didn't. It's not that it's not important. I mean, anybody would say no, it's not really important. But the point is, but they really didn't think or say it. It's not as though nobody cares. Most people do care about themselves or people near and dear to them, but what you do, most people don't care. If they're, if it's sort of like people are gossiping, it's irrelevant. It's really irrelevant, totally irrelevant in the big picture. You know, please yourself, please
Please
yourself with a
yourself.
lot of these things. Yeah,
Yeah. Maybe this is the answer to this question I was about to ask. But before we kind of move towards ending, is there something that we should have been talking about or should still be talking about that I've missed?
that's a good question. I think something came to me today, and I'm trying to think why it came to me. Because I was sitting here and something came to mind, and it's just a few words, and maybe we'll just throw it out because it's it uh, that reality is constructed minute by minute, and if you take that position, you can't go wrong in a way because you could reconstruct it, you could deconstruct it, you could reconstruct it. So if you see it one way, okay, that's that reality, but you could switch it. You could say, yeah, but I see it a little differently now, right? And
Mm,
I think that's a helpful thought. You may or may not change how you see it, but you can, or it can be changed to take the passive voice.
yeah. This is a little bit something to what you were saying earlier, that this adaptability, right? Like, meaning if you come out of therapy knowing that you're more adaptable, more able to roll with the
Flexible.
punches, flexibility, like your reality is also flexible. Like you can see reality and experience it one way, but you can also choose and to be a part of this reality with flexibility and see it maybe a little different.
Exactly. So it prevents a certain amount of disappointment. Something happens or it doesn't happen, and you're disappointed. Okay, it happens. I mean, disappointment is understandable, but getting off of that, shifting to the next step, And again, we don't want to I mean, people are entitled to their feelings, you know. So
Mm,
it's kind of tricky because with a patient, with a client, they're coming in with hurt feelings, right? You can't talk them out of their hurt feelings. They're in pain, but you do want them to be able to move past that. Right? You don't want them to be stuck on the pain. So it's that little dance of that shift that you have to help them make. This is terrible, and I'm moving forward. Both, not like this isn't terrible. It sounds easy. It's not easy. It's not easy. That
I
message.
wonder if you're going to use one of these messages to this kind of like a closing question. If you had you're on this podcast, you have a message to the world, um, that could be, you feel like a singular message that be helpful and meaningful for people to hear. And I think that we've had quite a few of those today. So you can very comfortably say, I think we spoke about those moments already, but if there's something else that you think, um, would be a message that I'd like to share with the world through this medium, what would it be?
Um, could phrase it in two different ways. One thing that the short message is, um, light. Excuse me. Ugh. Life is hard. There are going to be bumps. There's no way to avoid it. No matter how perfect you become, no matter what you think, no matter what you wish, no matter what therapist you have, there are going to be bumps. So just be prepared. Don't take it. Don't take it personally, but just expect that there will be challenges, and don't think nobody else has those, because everybody got them, right? And the way I like to explain this, and I is, it works in Crown Heights. It may not work in other neighborhoods, but when you look at our houses on, my street or other streets where there's like brownstones, right? And often they're all alike, or they're certainly the same width. So you know that they're all alike in a certain way. And it looks very uniform and very boring or whatever. It's very uniform. They all look alike. But when you go into the alleys in the back, they're all different. Some are bigger, some are smaller, older, newer, fixed, unfixed, right? So everybody you see everybody on the street. Everybody looks like they have it better, have it easier. Everything's fine. But if you look behind, every house has a story. Every family has a story. They're all different. There's all kinds of, whether it be drama or challenge of another sort. Every house has a story. Every family has a story. And so you have to understand that what things look like and what they are not the same. Right? Don't have illusions. I think that's very important. You know, doesn't mean your problem isn't different than the next person's, but everybody got some. So yours may not be. You may not be worse than the next person. You are not less uh, uh, what's the word? Valuable. You are not less. You are not less worthy. You know, your
And
problems
it
are
answers
real.
in some way the question of why me? Why me? Because everyone is a why me.
Everyone has something. This is yours. Theirs is theirs. But everyone got something.
Maybe a habit that you've acquired in your life, a way, it could be something like drinking a coffee or taking a moment or whatever, that you feel like if people were to maybe can learn, obviously adapt it to their world and environment, but a habit that could be helpful, that created some form of joy, stability,
Uh,
peace in your life.
I'm an addictive reader. I read constantly of all sorts of things. I'd like to read a lot of psychology books, but not only. It's just whatever is interesting. So it could be history. It could be, some history, social, cultural things, some novels. I've always been, I almost never didn't have a book in my hand someplace. Um, and wide interest. So I've absorbed all of that. I am a big coffee drinker, though. You hit it right on the head there. It's got to be strong with milk and sweetener. Um, uh,
But
I
bring that back to the book is be curious. Don't lose your curiosity.
Curiosity, open-mindedness, interest, very important. Right. And I like to keep my hands busy also. So if I'm not reading, I'm hopefully
Fiddling
knitting, crafting, or painting,
or
or
painting, right? Right.
painting and drawing, depending on what's available.
I want to take a moment to really thank you. Thank you for joining me here
Pleasure.
today. I think there's a lot of little nuggets and some maybe bigger nuggets of what is therapy, what it is not, when to go to therapy, maybe when not, what is the purpose of it all, like how have I arrived in therapy, what does it feel to be stuck? And I appreciate you taking the time and sharing with I think a little bit from your storied career, and I truly appreciate it.
Thank you so much for having me. I hope a little bit of a nugget or two are useful to some or many. Thank you
Thank
very
you,
much.
and have a beautiful day. Take
You
care.
too. Take care. Bye-bye.